What we eat shapes everything, from our energy and focus to how long and how well we live. But for too many families, access to healthy food and nutrition education is out of reach, creating cycles of poor health.
Many people are underinsured or uninsured and work multiple jobs. The common thing to do is eat processed food and fast food.
Limited access to fresh, fiber-rich, and nutrient-dense foods, along with inadequate health care and unstable income, makes it harder for many families to choose the foods we know can help prevent poor health. In Santa Barbara County, 6 in 10 adults live with chronic illnesses like heart disease, type 2 diabetes, and cancer, conditions that disproportionately impact low-income and Latinx families. Yet, even within the healthcare system, there's a missing link. Most doctors receive less than 1% of their training in nutrition.
Doctors receive little training in this area of medicine, mainly due to the fact that medicine is based off of a diagnostic model, not necessarily a preventative medicine model,
leaving many providers and community members without the tools to address conditions at their root.
We desperately need in our community organizations that can be there in neighborhoods with families, with patients, with doctors for that matter, to provide that missing element, improved health care and nutrition education.
That's where Rooted Santa Barbara County comes in, a nonprofit dedicated to building a healthier community for everyone. By partnering with local organizations, Rooted is filling critical gaps, including the needs for healthcare training and nutrition education.
Lunch, easy and frijoladas. Do you enjoy a home-cooked lunch but don't have a lot of time? This enfrijoladas recipe is quick to make, has lots of flavor, and is packed with protein and fiber to keep you full until dinner.
Last year, we piloted our first Train the Trainers program, where we invited professionals and providers and community health workers from organizations across our community. I believe we had about 10 organizations that were involved in these 2 pilots. One was in English and one was in Spanish, where we provided a full program of training on lifestyle medicine and plant-based nutrition. And we saw the impact that we can make. We saw the ripple effect that can happen when you train one community health worker and equip one healthcare provider with knowledge around lifestyle medicine and plant-forward nutrition. You have the potential to reach 1,000 community members a year.
For those of us who practice medicine, organizations like Rooted are an extraordinary resource because as much as we know, there are gaps.
And I do think that Rooted Santa Barbara County is helping to fill this gap by honestly educating providers with critical lifestyle medicine tools that are available through the American College of Lifestyle Medicine.
Rooted Santa Barbara County's mission is to provide nutrition education that's culturally relevant and that emphasizes the skills that people already have. By focusing on access to healthy food, we support the community in making informed choices that improve their health outcomes so that they can break generational cycles of disease in their family.
What we need is more preventative care, better fundamental underlying health.
Research says an incredible amount about the power of food in preventing disease. Food really is medicine, and no matter where you live in the world, you can really access improved health simply by improving your diet.
Rooted is helping to shift healthcare from treatment to prevention by creating awareness of how food impacts health while honoring cultural traditions and individual needs.
Lifestyle changes could prevent or improve 80% of chronic conditions, but only if we have the knowledge, resources, and support to make and sustain them.
Real change happens when people have the tools and support. That's why Rooted Santa Barbara County builds strong community partnerships, provides healthcare training, and offers bilingual nutrition education to make healthy choices easier and culturally relevant.
Hopefully, we can break these multi-generational cycles of unhealthy eating, and ultimately we have reduced causes of morbidity and mortality down the line.
Rooted has to be on my and everybody else's short list of organizations in town to make sure in 2025 that we support.
The impact donations have is that we are able to reach more people and develop more programs.
We're able to not only get out into the community to provide nutrition education, we're also able to inform the community of resources like the food bank to gain access to foods that they may not currently have. This has a direct impact on health outcomes in the community and chronic disease.
Your donation will help expand our impact by training local leaders and bringing culturally relevant nutrition education to our homes. When our community thrives, we all thrive. Your support today helps us root for a stronger Santa Barbara County. Join us in building a healthier future together.